Hello everyone, my name is Dr. Grigoriy Klimovich, and today I will be talking about bariatric surgery. I work at Middlesex Health, which is located in Middletown, Connecticut. A little bit about me. I completed medical school at the University of South Carolina School of Medicine. Then I did 5 years general surgery residency at University of Miami, Jackson Memorial Hospital. Then I went on and did a fellowship in bariatric and minimally invasive surgery at Yale University School of Medicine. I am both board certified in American Board of Surgery as well as bariatric surgery. This is my family, beautiful wife and lovely two kids. As you can tell from these pictures, I really enjoy spending time with my family. I love these boys more than anything. We also have two dogs. My older son is obsessed with the bigger dog, and they are best friends. Back to bariatric surgery, our center is Center of Excellence, both by American College of Surgeons as well as American Society for Metabolic and Bariatric Surgery. What does it mean? It means that our complication rate is very low and our success rate is very high. If you are going to have a surgery, you do want to make sure that your bariatric surgery is done at Center of Excellence. Our nurses and physical therapists are trained to take care of bariatric patients, and our facilities are designed to take care of bariatric patients as well. Unfortunately, there are a lot of medical conditions that are associated with morbid obesity. For an instance, 77% of patients who are morbidly obese have a sleep apnea. What does it mean to have a sleep apnea? Sleep apnea is when you have so much fatty tissue around your neck that precludes you from providing enough oxygen for your body when you are asleep. These patients tend to wake up in the middle of the night and gasp for air, as they snore at night, as they are tired throughout the day. And there are a lot of other symptoms of sleep apnea. Morbid obesity is associated with diabetes mellitus, high blood pressure, elevated cholesterol, different kinds of heart problems, arthritis. Obese patients tend to have extra weight that causes wear and tear on their joints. And by having surgery and losing that extra weight, will decrease the wear and tear on your joints, and you might not even require orthopedic procedure that your orthopedic surgeon might tell you that you need to have. In addition, morbid obesity is associated with urinary stress incontinence as well as different types of menstrual irregularities. Obesity is also associated with different types of cancers, including colon cancer, prostate cancer, endometrial cancer, ovarian cancer, and breast cancer. Obese men are 33% more likely to die from cancers than non-obese men, and obese women are 55% more likely to die from cancer than non-obese women. In general, obese individuals are 40% more likely to develop heart attack and die from it than non-obese individuals. This is the major cause of preventable death. This is another slide that summarizes the impact of obesity. Obese individuals definitely have decreased quality of life. As they come to my office and they say, "Doctor, I would like to lose weight because I want to be able to keep up with my kids or my grandkids." As I have described and mentioned on previous slides, obesity is associated with various different types of medical comorbidities, An example would be high blood pressure, diabetes, heart disease, sleep apnea, and high cholesterol. And by having surgery and losing that extra weight will completely eliminate these diseases, or at least lessen in severity of having these conditions. Obese individuals also prone to have disability. An example would be severe arthritis that would require having some sort of joint replacement. That extra weight causes wear and tear on various different joints, and these patients end up seeking orthopedic attention and requiring orthopedic surgery for this wear and tears that extra weight has caused. Without a doubt, obesity is associated with increased medical costs. And this is linked with other medical comorbidities that are associated with obesity. Obviously, having a high blood pressure, high cholesterol, heart conditions, sleep apnea, and treating these conditions requires money, and therefore obesity increases the financial burden that it has on individual and on the society. Without a doubt, obesity reduces the life expectancy, at least by 16 to 14 years, and having a surgery and decreasing that extra weight and decreasing the comorbidities will prolong your life expectancy. I'm sure that majority of you already know what body mass index is. Body mass index is also known as BMI. It is calculated based on your height and your weight. The ideal range for body mass index is from 18.5 to 24.9. Individuals who have body mass index greater than 30 are considered to be obese. There are different types of obesity: severe obesity, morbid obesity, and supermorbid obesity. All depends on your number, on your BMI number. It's very easy to calculate BMI. All you have to do is go on Google on your smartphone and type BMI calculator, and it's going to ask for your height and your weight. And once you plug those numbers in, it is going to give you BMI. In order to qualify for bariatric surgery, you need to fall in one of these two criteria. First, you need to have BMI over 40, or the second criteria, you need to have BMI from 35 to 39.9, as well as you need to have diabetes mellitus, high blood pressure, or sleep apnea. Being morbidly obese puts you at much higher risk of dying. As you can see on this graph, y-axis we have mortality ratio, and x-axis we have body mass index. Mortality starts to pick up when you cross or when you go above a BMI of 35. And then mortality substantially increases when your BMI goes past or over BMI of 40. Morbid obesity is a national problem. As you can imagine, certain states are affected more than others. For an instance, look at these red states. These red states have a percentage of individuals who have obesity greater than 35. If you look at the state of Connecticut, where we are here, the obesity percentage ranges from 25 to 30. You might ask yourself, what causes obesity? It's a multifactorial issue. Obviously, genetics plays in. Lack of exercise, a lack of sleep, side effects of different medications, And obviously, if we eat more food than we need, if we consume more calories than we spend, we end up storing those extra calories in the form of fat. We convert those extra calories into fat, and that's how we gain weight. There's no question that all of us need to completely eliminate soft drinks and sugar beverages. There should be no juices, no Coke, no Dr. Pepper. All of these drinks need to be completely eliminated. All of us need to be drinking water. I'm also not a believer of diet drinks, like a diet Dr. Pepper, diet Coke. There are a lot of evidence show that those drinks are also associated with obesity and with various different medical conditions. Another reason why individuals are obese is the food supplies that we have in this country. Where I grew up in Ukraine, there were only very few people who were obese, and those individuals were very rich, or in my own eyes they were rich, because they had that extra food. Majority of us did not have enough food, and the prevalence of obesity was certainly much lower than it is in this country. This is one of my favorite slides. Let's look at a meal from McDonald's. This meal has Big Mac, large fries, and large soda. So a Big Mac contains 590 calories. A large fries contain 540 calories. And large soda have 310 calories. If you add all of this up, it's 1,440 calories. It's almost 3/4 of the calories that you need for a whole day. And if you would want to go on a long run and burn off those calories, it would take you 9.5 miles, which is a lot. For me, it would take close to 2 hours to run off those calories. So I want you guys to be very cautious with what you eat. For an instance, those 310 calories from large soda, you probably can substitute with something else, like with water. In addition, this is a nice information to know. 1 pound of fat equals 3,500 calories, which would require you to run 31.8 miles to burn off those calories. There are a few different modalities for treatment of obesity. First, diet industry. Diet industry does not work in general. Only 5% of individuals who follow diets are able to keep their weight off. As soon as you stop dieting or following a specific diet, individuals tend to regain the weight, and a lot of them gain more weight than they lost. Second is weight loss drugs. Weight loss drugs don't work, as they are expensive, as they have side effects, and as soon as you stop them, you regain the weight. Just in my experience, they are not as effective. And lastly, weight loss surgery. Weight loss surgery works 80% of the time. On average, patients lose 60% of excess body weight. And this is an important piece of information that might show up on your quiz. The reason why patients regain weight after the surgery is because they do not follow the recommended diet by us, or they do not follow up with their bariatric surgeon. Bariatric surgery works by a few different mechanisms. First, it decreases how much food you can absorb. Secondly, it causes calorie malabsorption. If someone has a gastric bypass, they can't absorb as much food or calories as they would have without bariatric surgery. And third, there are a lot of hormonal changes that are happening after bariatric surgery that make you feel less hungry. And if you are less hungry, you are less likely to eat more, and that causes significant weight loss. In an example of a gastric sleeve, where you take part of the stomach, that part of the stomach produces hormones that trigger your brain to be hungry. So if you take out that part of the stomach, you're no longer triggering those hormones that would cause you to be more hungry. In addition, these hormones that make you less hungry, they also work together and cause your glucose level to be lower, and that is how this works for improvement or complete elimination of diabetes. There are a few different procedures that are used for treatment of obesity. First one is gastric bypass. This surgery used to be performed more frequently in the past, and currently it is not as common of a surgery as it is the second surgery, sleeve gastrectomy. So with the first surgery, we do quite a bit intestinal rearrangements. And with the second surgery, we basically take off about 85% of your stomach and leave you with the stomach that is smaller than a banana. A third procedure is called gastric banding. This procedure we are no longer offering at Middlesex Health. Now I would like to talk about gastric bypass. What we do is in this surgery is we divide the stomach over here. Then we create intestinal rearrangements and connect the small intestine to this gastric pouch. And that is a bypass for you. This surgery works better for individuals who have a bad reflux or GERD and have type 2 diabetes. On average, these individuals lose a bit more weight, not significantly more, than a sleeve gastrectomy. Some individuals, although rarely, they develop a dumping syndrome. What dumping syndrome is when an individual eats sweets and as they end up feeling horrible after eating those sweets. And the reason they're feeling horrible is because they are hypoglycemic. What it means, hypoglycemia, is when your blood glucose is low. Also, these individuals can have a diarrhea. This slide describes the risks of gastric bypass. As you see, there are early risks and there are late risks. Early risks include leak, pulmonary embolism, pneumonia, and death. What pulmonary embolism is when a clot forms in your leg and travels to your lung and cause you having a problem with breathing. The late risks include small bowel obstruction, strictures, and marginal ulcers. Strictures and marginal ulcers happen where you connect small intestine to the small piece of stomach. Individuals who smoke do not qualify for bariatric surgery, and therefore you need to stop smoking. if someone has been smoking in recent past, I would not offer them gastric bypass because they might go back into smoking, and that will predispose them of having marginal ulcer. The next piece of information is very important and will show up on your quiz. Individuals who have gastric bypass are not allowed to use NSAIDs. What NSAIDs are is naproxen, ibuprofen, and etc. These individuals who have gastric bypass are allowed to use Tylenol, which causes no problems. And the reason gastric bypass individuals are not allowed to use NSAIDs or ibuprofen is because it increases marginal ulcer risk. In addition, the consumption of alcohol increases the risk of having marginal ulcers. Sleeve gastrectomy is most common bariatric surgery nowadays. What we basically do is we take out 85% of the stomach. Patients who undergo sleeve gastrectomy have stomachs that are less than the size of a banana. And by having this surgery, you have two things that are going on. First, you cannot fit as much food into your stomach, and secondly, the stomach that we are taking out from the patient's abdomen is no longer producing hormones that make patients hungry. And this is the main mechanism how patients lose weight. By 1 year, patients who undergo sleeve gastrectomy lose about 55 to 60% of excess body weight. Individuals who have BMI greater than 50 could have sleeve gastrectomy first, and if they are not satisfied with the weight loss, or if they would like to lose additional weight, this small stomach can be converted to bypass and patients can lose additional weight. This surgery is covered by most insurances. These are the possible complications after sleeve gastrectomy. Again, the complications are extremely rare, but they are certainly possible. This picture shows old bariatric procedure called adjustable gastric banding. What we basically do is we place a band around upper portion of the stomach, and then we inflate this band with saline. And individuals who have this band in place have constriction of the stomach, and as they can lose some weight with this operation. We are no longer offering this surgery at Middlesex Health. The surgery is associated with numerous complications, including band erosion, band slippage, problems with the esophagus, and etc. A lot of patients who have this surgery done in the past, as they had their bands taken out, and different surgeries can be offered for those patients who have their bands taken out. In this slide, I would like to summarize two bariatric operations that we do: sleeve gastrectomy and gastric bypass. By far, sleeve gastrectomy is considered to be the most common bariatric operation in the United States. It is safer than gastric bypass. Gastric bypass does have more complications associated with it. As far as weight loss, these two surgeries are quite comparable. Patients who have a gastric bypass lose slightly more weight than patients who have a sleeve gastrectomy. But again, the weight loss is quite comparable. As far as resolution of different medical comorbidities such as diabetes, high blood pressure, sleep apnea, and cardiac conditions, these two surgeries are quite comparable. Individuals who have a bad reflux, they would be better off undergoing gastric bypass than sleeve gastrectomy. In fact, gastric bypass is considered to be a treatment surgery for patients who have gastric reflux. Individuals who have a lot of joint problems and who rely heavily on naproxen and on other non-steroidal anti-inflammatory medications should strongly consider having a sleeve gastrectomy and not gastric bypass, because non-steroidal anti-inflammatory medications predispose patients to develop marginal ulcer, which happen at this level where we connect stomach with small intestine. Bariatric surgery is very safe. It is much safer than taking your gallbladder out or having hip replacement surgery. Mortality of bariatric surgery is 0.1%. It is much more risky for an individual to stay overweight than having a weight loss surgery and getting down to a healthier weight. Please pay attention to this piece of information, because you might see on the quiz that we will require you to take. This slide looks at BMI reduction 1 year out after bariatric surgery. So the two surgeries that we offer is sleeve gastrectomy, which is the most common bariatric operation, and gastric bypass. So on average, individuals who have sleeve gastrectomy have 12 point in BMI reduction, and individuals who have gastric bypass have about 15 points in BMI reduction. So what determines what surgery you get? First of all, is the patient's preference. Certain individuals would like to have a gastric bypass, and others would like to have a sleeve. Then we also look at other factors, such as if patient has a reflux, diabetes, other medical conditions. We also look at patient's BMI, history of smoking, medications, as well as arthritis. And I will sit down with you in the office, and we will come up with a decision as far as what surgery is the best for you. As there are some preoperative considerations, as there are predictors of success postoperatively after bariatric surgery. One of them is preoperative weight loss. Individuals who lose weight before the surgery are more likely to lose substantial amount of weight after bariatric surgery and keep the weight off. Individuals who have untreated mental illness, eating disorders, active substance abuse, and preoperative weight gain are more likely to fail after the surgery. Bariatric surgery will not be offered to you if you are active smoking preoperatively. All of the cigarettes and smoking, as well as nicotine products, have to be stopped at least 2 months prior to the operation. If you are interested in a smoking cessation program, we have ones that can be offered to you. We test all of our patients with urine toxicology preoperatively to make sure that we do not operate on smokers. About 75% of bariatric patients who undergo bariatric surgery have a sleep apnea. In office, we will screen you for sleep apnea and we will send you for testing if necessary. Untreated sleep apnea is a risk factor for perioperative complications, and therefore we ask you to bring your CPAP machine to the hospital and use this after the surgery. We will want you to continue to use CPAP machine after the surgery until you have a substantial amount of weight loss and you feel better and your sleep doctor have approved you to discontinue using CPAP machine. This is a pathway to get bariatric surgery. First, everyone is required to attend a seminar. You are doing it now. You are doing it online. Once you finish with these videos, there will be a phone number and my personal email through which you can contact with us. Once you contact with us, we are going to schedule you to see me in the office, or we can also schedule a Zoom meeting, which is virtual meeting where I will discuss what's the best surgery for you and will answer any of the questions that you might have. If you are a smoker, we will talk to you about smoking cessation and we will offer a smoking cessation program for you in order to facilitate this. Depending on your insurance, you might be required to have 3 months versus 6 months of nutritional or dietitian visits. Everyone is required to have psychiatric screening, upper GI, and laboratory work. Once you complete all that, you will see me in office to make sure everything is squared away, and I will answer any additional questions that you might have, and then you will be scheduled for surgery. After the surgery, you will stay in the hospital for 1 to 2 days, and then you will be discharged. And after discharge, you will be required to follow up with me personally. I would like to discuss with you specific bariatric preoperative requirements that each of you will have to complete before bariatric surgery. First, you will see me in the office or via virtual visit through Zoom. Then we will order a set of labs that are specific for bariatric patients. Each of you will have to see a psychiatrist or a social worker in order to get clearance for bariatric surgery. Then, depending on your insurance, you will have to have a total of 3 to 6 monthly dietitian visits. Everyone is also going to get upper GI, which means that you have to drink some contrast, and we take a picture of your stomach to make sure that everything is good. In addition, depending on your age and risk factors, you might need cardiac stress test, echo, or much more frequently, you might need a sleep study. And some individuals might require colonoscopy or mammography. Once everything is completed, you will see me one more time in the office, and then you will be scheduled for bariatric surgery. After surgery, you will go into the recovery room where you will stay there for a few hours. Then you will be transferred to our bariatric floor where we have bariatric rooms, bariatric toilets, and everything that's necessary for bariatric patients. Our physical therapists and our nurses are specially trained to take care of bariatric patients. For the first 24 hours, you are going to have a heart monitor on, as well as pulse oximeter, which is an equipment on your finger that detects your oxygen level. On the next day, we're going to check your blood work to make sure that everything went fine. After the surgery, you will be started on a very specific diet, and your diet will be advanced as you will be staying in a hospital. In addition, you will be asked to walk around early on, even on your first day after the surgery. You also will be started on blood thinners in order to prevent any blood clots forming in your legs. You will also be wearing compression stockings on your legs, and these compression stockings will be doing massage on your legs in order to prevent the blood clot forming in your legs. On average, patients stay in a hospital 1 to 2 days. Depending on your job, most patients are ready to go back to work in 2 to 3 weeks with both sleeve gastrectomy and gastric bypass. After the surgery, you will be closely followed by me and nutritionist. Your diet will be advanced in staged fashion. I will ask you to consume certain volume of fluid per 24 hours. I will ask you to minimize consumption of carbohydrates and fats. I will also ask you to consume 60 to 70 grams of proteins daily. In addition, regular exercise is important. We want you to exercise 3 to 4 times a week and about 30 to 45 minutes per day. A lifelong follow-up is important. A lot of evidence and research indicate that patients who follow up on a fairly regular basis are the ones who lose the weight and are able to keep the weight off. It is necessary, especially with bypass, that bariatric patients take certain vitamins, and we will keep a very close eye on that to make sure that you are taking these vitamins. Also, you will be asked to take proton pump inhibitors or H2 blockers, which are medications to protect your stomach. If there are any issues after the surgery, you will be asked to call 860-358-8698. And if you have any emergencies, we will ask you to go directly to Middlesex Health Emergency Department. Individuals who lose a lot of weight, they will have excessive skin. And majority of these individuals would like to have excessive skin removed. We will work very hard with your insurance, with your primary care physician, and with your dermatologist to get approval from your insurance to have panniculectomy or excision of the excessive skin. It is often required that you have multiple visits from your primary care physician or dermatologist documenting rashes and need for treatment of rashes due to excessive skin. This is a post-operative follow-up schedule that I follow with my patients after the surgery. I will see you at 2 weeks, at 2 months, at 6 months, at 1 year, and then yearly after. 6 months and 1 year, as well as yearly after visits, will require you to have some blood work before the visit. Bariatric surgery is a tool to help you reduce daily caloric intake. By having a surgery, you will decrease how much food you can consume, as well as you will have hormonal changes that will suppress your hunger. We also will encourage you to adopt healthy lifestyle changes like exercise. By no means, bariatric surgery is not an easy way out. you will have quite a bit of hoops that you will have to hop over before the surgery can be scheduled. In addition, surgery is very safe, but it is not without risks. Research indicates that long-term success rate for individuals who have bariatric surgery is 80%. Obesity negatively affects most systems within patient's body. It is much riskier for patients to stay obese than to undergo a safe surgery and lose weight and decrease the risk of dying from various conditions and diseases. Research indicates that patients who undergo surgery benefit from 89% reduction in 5-year mortality. This is due to resolution or significant improvement in different medical conditions. I would like to summarize my presentation. Obesity contributes to various medical conditions, including high blood pressure, diabetes, cardiac disease, and sleep apnea. As all of you know, is that medical obesity also causes disability as well as premature death. Bariatric surgery is by far the most effective treatment for medical obesity, but bariatric surgery is not common without risks. This is a safe surgery, but there are some risks involved as well. A lifestyle modification and exercise is necessary for long-term success. In addition, we will encourage you to follow up with us long-term on a yearly basis. After watching this video, I hope that you are ready to make some steps for a healthier life. If you are interested in bariatric surgery, please call my medical assistant Donna. Her phone number is 860-358-2967. Again, it's 860-358-2967. You can also email me on my personal email as you see on the screen, and I will have my medical assistant Donna call you within 24 hours. See you soon.